Back now on Triad Today, let's talk about when it's appropriate or not to go to the ER. And we do that with an expert in the field. With me now is Adam McHone. He's Emergency Department nurse practitioner and Director of Advanced Practice at Northern Regional Hospital, Mount Airy. Good to see you.
Thank you for having me.
First of all, let's sort of break this down into when you go to see your primary physician, when you might have to go to urgent care, when you might have to go to a hospital-based emergency department. Give me an example, maybe, of each one of when it's appropriate.
So we know that the main role of your primary care provider is to diagnose and manage chronic disease, and this is things like high blood pressure, high cholesterol, or diabetes.
Right.
They also ensure that you're staying up to date with your health screening exams like colonoscopies and mammograms, and make sure that you're staying up to date on vaccines. So if you have something like mild musculoskeletal pain and you feel that it's safe to wait a couple of days, then it's appropriate to call your primary care provider to see if you can get an appointment.
Okay, but then there might be a time where urgent care is appropriate. When would that be?
So if you feel like you need to be seen sooner, then the decision becomes, do I go to the emergency department or urgent care? The urgent care is best suited for seeing patients with minor scrapes and cuts, cold and flu symptoms, symptoms of a urinary tract infection, or mild gastrointestinal symptoms without significant abdominal pain.
Because even though that's important to me as an individual, if I'm going through that, those are not the kind of things that are the best use for an ER, right?
Correct. So we try to preserve the ER for patients that are having chest pain, shortness of breath, symptoms of a stroke, or significant abdominal pain, symptoms like that, where you should call 911 or go directly to the emergency department.
Well, I know this is going to sound like a stupid question, but why is it important to know when it is appropriate to go to the ER? Why is that important?
Well, we never want to delay, seeking care for an emergency. And if you're having chest pain or shortness of breath, it could be a serious diagnosis. So we don't want you to wait to go see your primary care provider or delay care by going to the urgent care when they're going to just have to refer you to the emergency department.
Now, let's talk. You mentioned the word delay. Let me go from there. Because a lot of times people say, gee, I really don't want to go. I think I need to go to the emergency department, but I really don't know if I want to because I heard that there's these long waits and everything. Can you either dispel that or explain that, or how does it go at Northern Regional?
Yeah, at Northern Regional, that's definitely a challenging question anywhere you go for an emergency department, because one thing we do not know is what's going to come through the door and what could consume the resources of the department. But at Northern Regional, whenever you come to the emergency department, within minutes of arrival, you're going to be evaluated by a triage nurse. That triage nurse is going to take your vital signs and assess the severity of your complaint. Patients with higher acuity are going to be taken back to be seen first.
And how much pain you're in and things like that drive it.
Absolutely.
Heart condition, I guess, would take priority.
Correct.
And then sometimes, you go in there and you think, well, I'm the most important person here, and then all of a sudden maybe somebody comes in who was in a car accident or something. So there are things like that can be delayed. But all right, let's say I've gone to the ER for a particular problem or injury or whatever. What happens if somebody like yourself says, well, we've sort of determined that you're going to maybe need to do some follow-up surgery or some follow-up treatment, now what happens at that point?
So let's say you go to the emergency department and the ER provider sees you and orders necessary studies. Those studies come back and they come in the room and recommend admission. Let's say you come in for chest pain. In that instance, they're going to consult a hospitalist, which is an internal medicine physician. That physician will see you in the emergency department and they'll attend to your care while you're in the hospital. However, they may consult a cardiologist to see you while you're there.
Right. Now, here's something that, people who have infants and small children, I think they wonder sometimes, is an ER the appropriate place for them, or is everything sort of geared toward adult care?
No, definitely we see in the emergency department, we're equipped and trained to take care of patients across the lifespan. It's not uncommon to walk in the room to see an infant and then walk out of the room and go into the next room and see an elderly patient.
Right. Why are you looking at me when you said elderly? That's why, no, but so you're treating everybody and you have expertise and all that, and I think that's comforting to parents to know that. Hey, I appreciate that. Before time runs out on us, I want to make sure we put this up on screen, which is very important. www.choosenorthern.org. That's choosenorthern.org. Gives you lots of good information about all the capabilities and services and of Northern Regional Hospital, and I appreciate what you're doing to help people and educate us about the use of the
Absolutely.
ER. Thanks, Adam.
Thank you for having me.
Will you come back sometime?
Absolutely.
All right. As long as you don't call me elderly. All right, we'll be right back after this.